In the US, 1 in 3 persons suffers with hypertension. Are you aware of your status among them? Because it rarely causes symptoms, this illness, which results from too much blood pressure pushing against your artery walls, is referred to as the silent killer. High blood pressure, sometimes referred to as hypertension, can harm your arteries and greatly raise your risk of heart attack, stroke, heart failure, and kidney failure if left untreated. However, you can mitigate those dangers. Systolic and diastolic readings of blood pressure are represented by two numbers. It has been demonstrated that systolic blood pressure can be decreased to a maximum of 120 mmHg to lessen these hazards. There are two methods to do this: by altering one's lifestyle and by taking medicine. Even though some people can lower their blood pressure by changing their lifestyles alone, the two methods work well together. Managing blood pressure typically involves 30% medication and 70% lifestyle changes. Your blood pressure drugs won't function as well if you don't alter your lifestyle while using them. The phrase lifestyle modifications implies that you must alter every aspect of your life in order to lower your blood pressure, but even little adjustments can have a big impact. Here are 9 natural, non-pharmaceutical, changes that are suggested for lowering blood pressure. If you haven't subscribed, please do so to learn of more ways to stay healthy naturally. 1. Eat less salt. It's debatable whether your salt intake affects your blood pressure if you haven't been given a hypertension diagnosis. But pay attention if you've already received a hypertension diagnosis. The most significant approach to lower your blood pressure is probably to reduce your salt intake. A low-sodium diet actually lowers blood pressure just as effectively as 1.5 to 2 blood pressure drugs, according to research. The American Heart Association, AHA, advises against consuming more than 1,500 milligrams, or roughly 1 teaspoon, of salt per day, whereas the average American eats 3,500 milligrams on a daily basis. But because this restriction is so low, doctors at Cleveland Clinic have put it at 2,300 milligrams. It's fantastic if you can get there without drastically altering your diet and feeling unhappy, but lowering your intake to 2,300 milligrams or fewer can help a lot. It can be challenging to eliminate sodium because it is in many foods, but it is possible. Potassium chloride is a wise salt replacement that can be used. Some foods can start to taste overly salty for you after about 10 to 14 days of adjusting to a low-sodium diet. Your blood pressure should drop by 2 to 3 mmHg if you reduce your sodium consumption from a staggering 3,500 milligrams to a far more modest 2,300 milligrams. Your blood pressure should fall by 5 to 6 mmHg if you limit your sodium consumption to the tighter 1,500 milligrams per day that the AHA advises. 2. Consume more potassium. Because it aids your kidneys in eliminating extra salt, potassium can help reduce blood pressure. And as you just discovered, a reduced sodium intake corresponds to a lower blood pressure level. The opposite of sodium is potassium. Blood pressure rises when sodium levels are too high and potassium levels are too low. Fast food, processed foods, carbs, potatoes, and meat are all likely to be abundant in a diet that is low in potassium, which raises the risk of high blood pressure. Instead, make an effort to consume 3,000 to 3,500 milligrams of potassium daily by eating things like bananas, tomatoes, avocados, cantaloupe, carrots, grapefruit, spinach, kiwi, lima beans and nectarines, just to name a few. But there's a significant catch: if you have kidney disease, watch out for potassium intake as your kidneys might not be able to eliminate it. If you have hypertension, consuming the necessary amounts of potassium should lower your blood pressure by 4 to 5 mmHg. 3. Follow the DASH diet. Dietary approaches to stop hypertension, or DASH, was developed expressly to lower blood pressure. The evidence supporting this diet is actually so compelling that it is now regarded as one of the most significant non-pharmaceutical approaches to treating hypertension. The DASH diet is very well balanced, full of whole grains, fruits, and vegetables, and it can be used in conjunction with a low-sodium diet. When you engage with a dietitian or nutritionist to go over the fundamentals, it can be quite beneficial in decreasing your blood pressure. People who follow the DASH diet often adhere to the low-sodium and high-potassium recommendations and may also experience weight loss. Systolic pressure can be lowered by up to 11 mmHg of mercury by following the DASH diet, and it can do so in as little as a few weeks. Additionally, it may reduce your risk of developing breast cancer, colorectal cancer, and metabolic syndrome. 4. Get physically active. Exercise, especially aerobic exercise, has a remarkable ability to lower blood pressure. Your blood vessels must expand and contract as a result, keeping them flexible. Along with other advantages, it also promotes the growth of new blood vessels and boosts blood flow. There are also isometric resistance workouts and dynamic resistance exercises, such as weighted bicep curls, like wall push-ups. Depending on how frequently you perform them, how many repetitions you complete, and, with dynamic resistance exercises, what weights you use, they have the potential to drop your blood pressure by 4 to 5 mmHg of mercury. 150 minutes a week of aerobic exercise can reduce blood pressure by 5 to 8 mmHg of mercury. And if your blood pressure starts to climb right away after working out, don't panic. Although blood pressure rises during activity, it drops dramatically afterward. 5. Limit alcohol consumption. You run the risk of getting high blood pressure if you drink alcohol. And drinking might be a factor if you've previously been given a high blood pressure diagnosis. According to the dietary guidelines for Americans, moderate drinking is defined as 2 drinks or less for males and 1 drink or fewer for women each day. Ask your healthcare practitioner for additional individualized advice because your height, weight, and general health all affect what is safe for you. And not everyone finds it simple to drink less. You may have an alcohol use disorder if you're having trouble altering your drinking patterns. If so, treatment is available. If you habitually consume more alcohol than is advised and have hypertension, cutting back may cause a 4 mmHg of mercury drop in blood pressure. 6. Maintain a healthy weight. Your blood pressure rises along with your weight, so decreasing even a few pounds can significantly lower your systolic blood pressure. Our midsection specific fat cells are metabolically active cells. They release a variety of hormones, which eventually cause blood pressure to rise. Of course, the solution is rarely as straightforward as just lose weight. Numerous medical and lifestyle-related issues come into play when discussing the subtle and complicated subject of weight. But here's the thing, if you try your best to adhere to this list, weight reduction will probably follow, especially if you collaborate with your healthcare physician to ensure that you're doing things correctly. 7. Quit smoking. High blood pressure and smoking both damage the lining of your blood vessels. Smoking might be a hard habit to kick, but it's terrible for your health. 8. Getting enough sleep. Lack of sleep has a number of alarming implications on your health. We now know that wildly fluctuating blood pressure, which is just as harmful as high blood pressure, may be avoided by getting 6 to 8 hours of unbroken sleep each night. 9. Reduce stress. Chronic stressors can really affect lifestyle choices that are crucial for maintaining healthy blood pressure. Chronic stress or anxiety can make it more likely for you to make poor nutritional decisions, get fewer sleep, and engage in less physical activity. So there you have it. If you enjoyed this video, please don't forget to subscribe and share. Thanks for watching.